A very warm welcome to my channel at Doc Nature Lover. Today's topic of discussion is a very common thing. It is on erectile dysfunction. So what is erectile dysfunction? Erectile dysfunction is an inability to achieve or maintain an erection that is suitable for satisfactory sexual performance. As many as 50% or more people above the age of 50 have erectile dysfunction, or ED as we commonly say. The highest number of patients we encounter are above the age of 50. On the Massachusetts male aging study, we found that as age goes up, erectile dysfunction does go up. So patients who are above the age of 60, the erectile dysfunction or ED goes up to 60% and so forth. There are many causes of erectile dysfunction, and it is very important that we identify erectile dysfunction and the reversible causes of erectile dysfunction. Erectile dysfunction can be a lifelong issue, which is sometimes acquired. I have seen patients who are younger than age 20 that I have treated with erectile dysfunction. So it's not that it's prevalent only in the 50 and above population. Above the age of 40, we do encounter a lot of patients who are having erectile dysfunction or ED. It is a very difficult job for the patients to bring up this topic of discussion, and that is exactly where we need to be more clear about what erectile dysfunction is. And erectile dysfunction actually affects relationship of the patient. It also affects a lot of other things that could be a cause of erectile dysfunction. I'm going to talk about some of the causes of erectile dysfunction. I'm going to delineate the common causes of erectile dysfunction or ED. Number one is drugs. So beta blockers as a group, which is given for control of blood pressure, is one of the drugs that causes erectile dysfunction or ED. It's given commonly to patients. Number two is a diuretic, which is water pill, is called a water pill by lay people or common people, and it is one of the highest causes of ED. The next class of drugs which is very commonly used are antidepressants. A high amount of the population has antidepressants which they are using chronically. Tricyclic antidepressants, lithium, which is used in treatment of bipolar disorder, is one of the highest causes of reversible erectile dysfunction, and it can actually improve after you stop the drug. Number three is tobacco use. Tobacco disorder is one of the highest reasons of erectile dysfunction or ED. Next number is alcohol. Alcohol use, chronic alcohol use can definitely cause erectile dysfunction. Another class of drugs that we know about used for heart failure patients is called spironolactone, which can cause this. The next subsection of reasons for erectile dysfunction is trauma to the pelvic area or a spinal cord injury, which can cause significant erectile dysfunction, which may or may not be reversible in that case. There are some surgeries which can cause erectile dysfunction. Radical prostatectomy is known to cause ED. There is also evidence that supports that chronic bicycle use can cause neuropathy, causing an erectile dysfunction in people who do a lot of bicycling. And I've seen patients in my office as well, which has been able to reverse some of these causes. Another big subsection of these people is low T syndrome or low testosterone syndrome, which is very much highly prevalent in the patient classification that I see who have diabetes or heart disease or high blood pressure, and that is one of the very big risk factors that I have seen. The other problems that can cause erectile dysfunction or ED are thyroid disorders, which can cause hypothyroidism specifically. Another very big classification of problems or vascular reasons for erectile dysfunction is diabetes, because diabetes is affecting the entire population of the world. So diabetes is actually a vascular disease in which you have decreased blood flow causing erectile dysfunction. Together with diabetes, coronary artery disease or heart disease or atherosclerosis, which is plaque buildup in the vessels of the organs, causes ED very commonly. Another thing, it's very important to know that eating highly fatty food can cause difficulty in losing weight in patients, and that can affect erectile dysfunction. Exogenous obesity is one of the other reasons that can cause low testosterone or testosterone which is free. Another big cause of erectile dysfunction or ED is psychological erectile dysfunction, which is related to stress in your life, both stress at work or stress in your family. Also, decreased sleep in patients can cause ED, which is very common, and it's very easily fixed because the patient is told that this is the reason you're having the problem. If you get a good history from the patient, they are sleeping for 2 to 3 hours a day only, where they are not having any good amount of sleep or good quality of sleep or refreshing sleep. Overall, it can also be caused by severe anxiety in patients or performance anxiety in patients, and it can affect your relationships quite a bit. Peripheral vascular disease, stroke are the other causes of erectile dysfunction, and definitely Parkinson's disease and dementia in older age patients are cause of erectile dysfunction. It definitely affects their everyday life to a large extent of people. So number one treatment for ED is behavioral counseling. You have to definitely counsel the patients. You have to talk to the patients and ask them, are you sleeping well? What's your relationship status with your significant other? Are you having more stress in your job? And these are things that can actually improve ED without the use of medication. The number two treatment is drugs. These drugs are very familiar to us. One of the drugs, the Viagra, and the other, the Levitra, they can be used to improve erectile dysfunction or ED, and it's commonly prescribed for patients who have vascular disease, which increases the blood flow in the vessel. It is to be taken an hour before the sexual performance occurs, and it usually works up to 4 hours. There is another class of drugs called the Cialis, which can be used as an everyday medication for treatment of ED. The next problem that we arise is these drugs stop working after 5 to 6 years of use, and that is where you need to evaluate what's going on. So at this point, usually in my practice, I order ultrasound, a penile ultrasound is ordered, and I refer the patients to a urologist at this point, because that is where you are going to see problems, because you are going to see that the ultrasound shows decreased blood flow to that area, and that is one of the reasons that ED continues to be prevalent. Once you have referred the patient to the urologist, this is commonly the treatment protocol that they follow. So they would either go over the drugs or eliminate any drugs that would be causing. Sometimes I am able to identify the drugs and I would stop the drug. The next line of action that they do is putting a penile implant, which actually works very well. There is also injections that can be used which are usually given by the patients to themselves, the urologist usually recommend the use after we have exhausted the drugs pretty much. So overall, what we are seeing is this is a disease that has a lot of cure, and it actually can be very, very well controlled by a number of methods. And also, this is something that we need to have more awareness, so that we are asking patients, especially with the whole gamut of disease state that we are seeing, atherosclerosis or diabetes or heart disease or high blood pressure, we have to identify these patients. I hope you liked this video. If you want to continue watching health related videos, please do not forget to subscribe to my channel Doc Nature Lover. If you like this video and you want to continue watching health related videos, please do not forget to subscribe or follow me on Instagram at Nature Lover Keep Smiling, or you can also send your questions or comments on my email account, which is docnaturelover@gmail.com. I'll be outlining down below all my contacts, so you could request other videos that you want to watch. For the next video, I'll be taking up low testosterone or low T syndrome as the next point of discussion, as we see the whole gamut of diabetes affecting other patients. Thank you for watching.